Texas faces a severe shortage of primary care providers, a problem that stretches from our rural areas to our major urban centers. The Texas legislature is currently considering a dramatic plan to address this shortage by providing financial incentives for those willing to serve in medically underserved areas. Healthcare providers, patient advocates, and community leaders from the Dallas area gathered at the Martin Luther King Jr. Family Clinic to lend their support to this historic proposal.
North Texas is dealing with a shortage of doctors. Today, local health care providers, patients, and community leaders are pressing state lawmakers to pass a bill that would bring doctors to rural communities. Dallas and Tarrant counties are designated as two of the most critical shortage areas. Because of that, many clinics have closed.
We have a great shortage in the state of Texas. We have a shortage here at Martin Luther King Family Clinic, and patients are having to wait much longer to be able to be seen because we cannot accommodate the increased number of patients here at our center.
House Bill 1876 would assist doctors in paying off student loans in return for practicing in an underserved area of North Texas for 4 years.
En Texas se enfrentan una marcada escasez de médicos, enfermeros, practicantes y dentistas. Ante este panorama, proveedores en el cuidado de la salud, administradores de clínicas, pacientes y líderes comunitarios se unieron para ofrecer una conferencia de prensa y solicitar la aprobación de una propuesta de ley denominada HB 1876. Esta medida permitiría el acceso de fondos para el cuidado de la salud para el estado de Texas.
Con esta ley le podríamos dar a los doctores más posibilidad de ayudarles a pagar su loan. Cuando salen de la escuela, salen con deudas de arriba de los 150, 160 mil, 115 mil dólares, según quién es el que pone. Entonces, es muy importante para nosotros y por eso la estamos apoyando.
Clínicas como Barrios Unidos en el oeste de Dallas se benefician del plan que existe, pero sigue siendo muy restrictivo y no tienen suficientes doctores para la cantidad de pacientes que deben de atender.
The legislation that we have on the table is called House Bill 1876, the Texas Healthcare Access Fund. We are urging lawmakers to pass this before the end of the 81st legislative session, which ends in June 1st.
Having this bill passed would really just help us be able to recruit more physicians, dentists, and nurse practitioners to help us do what we do and do what we love doing.
The legislation would help healthcare providers pay off student loans in exchange for practicing in underserved areas.
But I grapple with the decision as to should I go somewhere where I know I'm going to make more money and I'll be able to pay that, or go where my heart really is.
More than half of the 254 counties in Texas currently need an additional primary care physicians, including Dallas and Tarrant counties. The shortage of doctors has forced some clinics to stop accepting new patients, while others have had to wait several months for an appointment. The shortage could also have a bigger impact on minority communities, which are typically underserved by physicians.
A way to get more doctors and dentists into areas that desperately need them.
The proposal would help healthcare providers pay off their student loans in exchange for their service. Here's NBC5's Christy Nelson.
I'm going to start by listening to your heart, okay, bud?
Dr. Stormy Williams keeps busy at the Martin Luther King Jr. Family Clinic in Dallas.
I was going to do nose.
Okay.
Nose!
So busy that patients have to wait longer than they should.
It's kind of hard for us to get the patients in as they need to be seen. So as of right now, if a person called to make an appointment with me, because I'm the only pediatrician here, they may have to wait 3 to 4 weeks to get an appointment.
It's frustrating for everyone.
If I have a 10 o'clock appointment, I expect to be seen at 10. I expect to be at home no later than 11:30 or 12. I don't want to spend my whole day at the doctor's office.
Deviante Blair.
The problem at this clinic and others like it is that new primary health providers are often heavily in debt.
Okay, you ready?
And want higher paying jobs.
There is a shortage because the providers who come out of school have loans that are as much as $160,000 on the average, and they want to work in an area where they can, or in an organization where they can actually pay those loans back.
A bill before Texas lawmakers would, if passed, create the Texas Healthcare Access Fund to help them pay off student loans if they make a 4-year commitment to work in places like this.
If you know that you can work somewhere 10 minutes away and make, $30,000 more a year, you would do it. And the fact that you might be able to get help with your loans to work here, I know would be a big incentive for a lot of people.
Christy Nelson, NBC5.
There is a statewide shortage of primary care providers, and the CEO of the King Clinic says that the Texas Health Care Access Fund would give her more recruiting power.
I'm standing here in support of this bill and asking that you give it your 100% support because it's going to help everything.
We're excited about having the opportunity to support House Bill 1876. We want to make sure that we can do whatever we can and be here for the community. Martin Luther King Family Clinic has been here over 23 years, and we'd like to continue to be here for a long time and expand out to other areas so that folks don't have to come so far to come see us.